Hi everybody, I am following up on a request that I've had to try and provide some information that can be useful for people when they're at the dentist's and in the process of being at the dentist can be asked some questions they maybe weren't expecting. And these questions relate to breathing and sleep problems. When you visit the dentist, the usual expectation is to have a look inside the mouth, have a look at your teeth and your gums, have a chat about your diet and brushing your teeth, flossing as well. What people are quite surprised to learn is that a growing number of dentists and dental clinics and the people they work with, the therapists and the hygienists, for example, have had further education and training in problems related to obstructed breathing during the night time. So in children, that could be things such as mouth breathing and snoring, and then in adults and children alike, it could be obstructive sleep apnea. And dental clinics and dental clinicians of the broader spectrum will often find things inside the mouth that are clues that there is a breathing and sleep problem. So, for example, they may notice that there's chipping or wear on the teeth from teeth grinding. Teeth grinding can happen because the oxygen levels at night are going too low. They may notice that the inside of the mouth is quite dry because there's mouth breathing, which is drying the mouth out. They may notice that the gums are inflamed, again, because of mouth breathing drying out the gums. The presence of dental holes, holes in the teeth, dental caries, is increased in people that have obstructed breathing at night. So they may start to notice that even though there's a good diet and good brushing and flossing, there's way too many holes in the teeth, and that just doesn't make sense for any other reason. They may also spot other things. They might obviously look at the back of the mouth and notice that the tonsils are quite big. They're there to be seen. So it's a very growing norm for dentists to be asking patients about their breathing and sleep. And they'll ask a whole heap of questions that relate directly to what could be related to dentistry, but also then, because of their education, asking a broader spectrum of things. So, for example, they'll ask about mouth breathing and snoring and stopping breathing. They'll ask about whether the person is tired in the morning. They'll notice some changes, perhaps, of teeth grinding, and then ask about what can be associated with that is things like sleepwalking and sleep talking and night terrors and bedwetting, disrupted sleep through the night. Then they may ask about hay fever and allergy and asthma, because that ties in with having a blocked nose and mouth breathing. And then, of course, they will, looking at the teeth, may notice things such as wear on the teeth from acid reflux. And acid reflux is increased in those that have obstructed breathing. So the dental clinic is actually really clever and really well set up for identifying or for screening purposes, identifying patients that then need to be referred on for further assessment of their breathing and sleep, usually initially with an ENT surgeon, because we're the ones that can have a look inside and clarify what's going on, and then address what's going on, and then make decisions about involving other clinicians such as sleep specialists, myofunctional therapists, allergy doctors, and the list goes on. The other thing we can do is that we can then give feedback to dentists as well about treatment planning too, because there's certain dental interventions that can be useful in this context too. So, for example, in children, if their jaws are narrow, which is again something the dentist will pick up, that can there's a treatment where they can make the jaws wider, and in making the jaws wider, but more importantly also bringing the jaws forwards if the jaws are sitting too far back, that will open up the airway space. And in adults, they may be able to make a mouth guard that holds the jaw forwards, that keeps the back of the throat open, and so forth. And again, as ear, nose and throat specialists, we can identify those things. So I think it's fabulous that people working in dental clinics are getting this education and forming networks of specialists to have a holistic team approach to people. So the next time you go to the dentist, don't be surprised if they ask about your sleep. Cheers.